Chicago, hog butcher for the world, tool maker, stacker of wheat, player with railroads and the nation's freight handler, stormy, husky, brawling, city of the big shoulders. They tell us we have a wicked problem, and we believe them. This is our inheritance. In Chicago, we know who we are and where we're from. Chicago's clinical scholars stand at the crossroads of public health and public schools. We dare to reimagine a culture of health here. This is our poster.
As background, community health workers are central to promoting health and to helping prevent illness. They are part of a model that's been implemented in clinics and community settings. In addition, asthma affects many children throughout our country, and disparities are quite prevalent. Schools are a key site for programs that promote health and wellness, and the use of community health workers in schools has been underexplored to date. As a result, our goal was to create an innovative and scalable model that integrates community health workers into schools. We sought to do this with a focus on asthma care as we develop, test, and refine a model that's maximally feasible. And in the long term, we hope to apply this model of integrating community health workers into schools to support children more broadly. In terms of methods, we started by developing our team and a steering committee to support this work. Our next steps included developing the model and also planning the evaluation for our pilot program. We also obtained all regulatory approvals, both in terms of research and data use, as well as partnership pieces. And next, we conducted a survey with schools in order to select the schools for the pilot program. We performed interviews with stakeholders within the school to understand their perspectives, and we've hired and trained the community health workers for the program.
Taking into account the racial and ethnic makeup of Chicago, the asthma outcomes we see in Chicago, and the school surveys, we selected 2 elementary schools to work with in which to integrate community health worker services. The 2 selected schools are in community areas that are predominantly Black or Latinx. This is reflected in the demographics of the selected schools, where one has a predominantly Latinx student population and the other has a predominantly Black population. Both serve low-income students. Our developed model reflects the functions of the community health worker workforce. First being outreach. Our CHWs will conduct asthma and social needs screening within the school setting. The second is navigation. The CHWs will provide linkages to medical care and other community-based supports for the families that we work with. The third, education. Our CHWs will provide education, self-management education in groups and at the individual level, both in school or in the home or other community-based settings. Fourth is advocacy through ensuring that students have the appropriate paperwork and supports that they need at school. And throughout, the CHWs are providing school level and individual support through informal counseling and social support services. Overall, our project, remote learning, really delayed the integration of the community health workers during this particular school year. But we do know through our work with the Chicago Public Schools that there is a very strong desire to train other Chicago Public School workforces as CHWs. And so we will be training a broader workforce than just the 2 CHWs working within the 2 schools. The survey results of our chosen schools really show that there is a very strong interest in integrating the CHW model within the schools. And really in those surveys reflected strong collaboration that's needed with nurses, secretaries, social workers, case managers, and teachers. And that the schools really anticipate needing community health workers to assist parents in managing prescription medication, really promoting the health, social, and emotional well-being of the students, engaging parents in education, and providing family support based on individual needs, as well as asthma education. Our next steps very soon include training for the community health workers and the broader workforce within CPS in community health worker core skills, as well as asthma management, really integrating the CHWs in the school, disseminating a parent survey regarding COVID-19 and impacts of COVID-19 on families. We will be piloting the program in spring 21 and evaluation and refinement for full integration within the 2021-2022 academic year. We are also working on a number of advocacy efforts, including for CHW certification and reimbursement pathways in Illinois, as well as to reverse the free care rule in Illinois to increase sustainability through a reimbursement mechanism.